Hello.
You,
Hello.
maybe you should just cook Thanksgiving. Let's make sure.
On October 28th, 2023, the world was shocked by the sudden passing of Matthew Perry, the beloved actor best known for his role as Chandler Bing on the iconic television series Friends. Found unresponsive in the hot tub of his Los Angeles home, Perry's death at the age of 54 prompted an outpouring of grief and numerous questions regarding the circumstances leading to his untimely demise. Investigations into his passing revealed disturbing details about the role of ketamine, shedding light on medical malpractice, exploitation, and the dangers of unregulated drug use. Matthew Perry's struggle with addiction. Matthew Perry's battle with addiction was well documented throughout his career. Despite his professional success, he faced significant challenges with substance abuse, particularly involving alcohol and prescription medications. In his 2022 memoir, Friends, Lovers, and the Big Terrible Thing, Perry candidly discussed his struggles.
I can't believe I just looked right at you. I'm so sorry. I can't believe Emma's still asleep.
I know. What are we going to do?
Revealing that he had spent millions of dollars on rehabilitation treatments and had undergone multiple surgeries due to drug-related health complications. His memoir was not just a personal reflection, but also an effort to provide insight and hope to others battling addiction. Perry was outspoken about his commitment to recovery and actively supported initiatives aimed at helping those struggling with substance abuse. Unfortunately, his own battle with addiction persisted in the years leading up to his death, despite his determination to stay clean. Autopsy findings. The role of ketamine. Ketamine, originally developed as an anesthetic, has in recent years been used to treat severe depression, PTSD, and other mental health conditions. When administered in a controlled clinical setting, ketamine therapy can provide relief for patients unresponsive to traditional treatments. However, due to its dissociative and hallucinogenic effects, it is also widely abused as a recreational drug. The autopsy report released on December 15, 2023, concluded that Matthew Perry died from the acute effects of ketamine, with drowning as a secondary contributing factor. The report indicated that Perry had an extremely high level of ketamine in his system, leading to unconsciousness and, ultimately, his submersion in a hot tub. Additionally, coronary artery disease and the effects of buprenorphine, a medication used to treat opioid addiction, were noted as contributing factors, further complicating the situation. Toxicology reports indicated that the levels of ketamine found in Perry's bloodstream were far beyond what is considered safe, raising concerns about how the drug was obtained and administered. While ketamine therapy is legal under medical supervision, Perry's case exposed a darker side of the industry, where vulnerable individuals are exploited by unscrupulous medical professionals. The shocking discovery of 27 ketamine shots. Further investigations into Perry's final days revealed that he had been administered 27 doses of ketamine in the 3 days preceding his death. This shocking revelation painted a disturbing picture of potential medical malpractice and reckless drug administration. Perry, who had a known history of substance abuse, was receiving treatment from individuals who appeared more interested in financial gain than his well-being. Among those implicated were Dr. Salvador Plasencia and a woman known as the ketamine queen, Jasveen Sangha. Perry's personal assistant, Kenneth Awamasa, also admitted to administering some of these doses without proper medical training. Investigators uncovered text messages between these individuals, showing a complete disregard for Perry's safety. In one exchange, Dr. Plasencia expressed eagerness to profit from Perry's dependency, referring to him in a derogatory manner. Reports indicated that Perry paid approximately $55,000 for 20 vials of ketamine in the 2 months before his death. This staggering amount raised concerns about the growing black market for the drug and the lack of oversight in its administration. Legal consequences and charges. Following the discovery of these alarming details, law enforcement officials launched a criminal investigation into those responsible for supplying and administering the ketamine. 5 individuals were charged in connection with Perry's fatal overdose. Dr. Salvador Plasencia, accused of conspiracy, unlawful distribution of ketamine, and falsifying medical records. Placencia pleaded not guilty and awaited trial. Dr. Mark Chavez faced similar charges and later agreed to plead guilty. His medical license was revoked. Kenneth Iwamasa, Perry's personal assistant, who admitted to illegally obtaining and administering ketamine. He pleaded guilty and cooperated with authorities. Eric Fleming, an intermediary involved in procuring the drug for Perry. He also pleaded guilty and provided evidence against other defendants. Jasveen Sunga, dubbed the Ketamine Queen, Sunga was charged with running an illegal drug operation and faced multiple federal drug charges. U.S. Attorney Martin Estrada emphasized that the defendants had exploited Perry's addiction, engaging in reckless behavior that ultimately led to his death. Authorities have vowed to crack down on the illegal distribution of ketamine and ensure that medical professionals who engage in such misconduct are held accountable. Broader implications: the dangers of unregulated ketamine use. Matthew Perry's death underscores the urgent need for greater oversight in the use of ketamine for therapeutic purposes. While the drug has proven benefits when administered correctly, its increasing availability and misuse have led to a rise in overdoses and adverse effects. Experts warn that without strict regulations, vulnerable individuals, especially those with histories of substance abuse, are at risk of falling prey to unethical practitioners. Perry's case highlights the necessity for stringent policies governing ketamine distribution, along with better safeguards to protect patients from exploitation. Medical professionals have also called for increased education and training on ketamine use, ensuring that it is only prescribed and administered by qualified experts in controlled settings. There is growing support for federal guidelines that would limit access to the drug outside of clinical trials and regulated treatment centers. Remembering Matthew Perry. Beyond the headlines and legal battles, it is important to remember Matthew Perry for his immense contributions to the entertainment industry and his advocacy for addiction recovery. As Chandler Bing, he brought laughter to millions worldwide, leaving behind an unforgettable legacy in television history. Perry's openness about his struggles with addiction helped break down the stigma surrounding substance abuse, encouraging others to seek help. His foundation, the Matthew Perry Foundation, was established in his memory to support individuals battling addiction, ensuring that his advocacy work continues even after his passing. The tragedy of his death serves as a cautionary tale about the dangers of addiction, the risks of unregulated medical treatments, and the importance of ethical responsibility in healthcare. As the legal proceedings continue, the case will likely serve as a landmark moment in addressing the misuse of ketamine and strengthening safeguards to prevent similar tragedies in the future. Conclusion: Matthew Perry's death was a devastating loss, not only to his fans, but also to those who admired his resilience and commitment to helping others.